Welcome to another lesson on the skeletal system, Notes 1.3, Classification and Composition of Bones. We will begin with a quick review of types of bones. So the first type is our long bone here, okay, which makes up most of our appendicular skeleton. So these guys are longer than they are wide. And then the next type is the irregular bone. They have all these odd prominences here, which would include our vertebrae. Flat bone, which includes our sternum, our scalp, or skull, as well as our pelvic girdle here. And our short bone, which include our tarsals and carpals, and then sesamoid bone, which is the patella. Okay, so when we discuss the composition of bone, long bone are organized in one way, whereas everything else will fall under this category here. Irregular will be composed pretty much of the same structures. Bone can be classified as having two different types of textures, spongy bone and compact bone. Okay, and just like it sounds, right, the compact bone tends to be very, very dense. And the compact bone will make up the outermost layer of bone. And then the spongy bone, it looks a lot like a sponge, okay? And they're made up of these sort of spindly, needle-like or flat-like components or bony material, which will allow for lots of different positions of pressure, while still having some spaces to allow blood vessels to pass. Looking at an image taken from a little section of our skull, we can see what that looks like in real life, and you definitely get that sense of that spongy appearance here and that compact bone on the outermost edge. Now, to discuss the composition of our different classification of bone, we'll begin with the structure of long bone. Long bone is organized in two major regions. We have what's called the epiphysis, which makes up the ends of the long bone. So we have a proximal, closer to the trunk, and distal, away from the trunk, epiphysis. And then we have this center part, which makes up the shaft of the bone, called the diaphysis. Okay. If we look a little closer within the diaphysis here, we have this hollowed out area known as a medullary cavity. Okay. And then lining our bone, so these are the major components. Lining our bone, we have a membrane called an endosteum, which will line the inside part of our bone. And then what lines the outside part of our bone, at least on the diaphysis component, is called a periosteum. Okay, and then on the very, very ends, we learned about this earlier when we talked about joints. So on the ends, we have what's called an articular cartilage. And again, just like we talked about earlier, we have the spongy bone, which makes up the inner components, and the compact bone, which lines the outermost edge. Let's take a closer look at our long bone at the epiphysis. So as we can see here, these guys tend to be much more expanded in width, the ends of our long bone. We have a spongy interior. And we have a very distinguishing feature is this what's called an epiphyseal line. An epiphyseal line, which is just a remains of growth from when you are getting taller and longer as you get older from childhood into adult. And the other distinguishing feature of our epiphysis is the articular cartilage, in which it is made up of hyaline cartilage. Fun fact, this epiphyseal line here, okay, as an adult, it's called an epiphyseal line, and it's actually made up of bone. It's like a bony tissue. However, when you are younger, when you are a child and still growing, It's called an epiphyseal plate, and it's not made up of bone. It's actually made up of the hyaline cartilage. Okay, it's made up of hyaline cartilage. So it's a major distinguishing feature that allows us to determine whether a bone is that of a child or that of an adult. Now, looking a little bit more closely at our diaphysis, we have, again, it's made up of compact bone. You're really not going to see any spongy bone. If anything, you'll see it on the very, very edges of our medullary cavity. So you have your compact bone, which makes up pretty much the entire shaft. You have this hollowed out cavity called a medullary cavity here. The medullary cavity is going to be filled with yellow marrow, particularly when you are an adult, and then covering the outermost surface of our diaphysis is what's called the periosteum, and the periosteum will help to anchor our blood vessels for our bone. In addition to the periosteum, we have these fibers, which are an extension of the bone to the periosteum, and they help to anchor the periosteum to the bone, and these guys are called Sharpeys, kind of like the pen, Sharpey's fibers. Okay, and then on the innermost layer we have the endosteum, and endosteum will line all of the surface of our spongy bone. The next classification of bone based on its structure comprises all of our short, irregular, and flat bones. They are all exactly the same in terms of their organization. There is no divisions. They much simpler than a long bone. To begin with, they have that periosteum, which will line the outermost sides or surfaces of the bone. The endosteum, which will line all of the spongy bone within. And then our bone marrow will fill in within the spongy cavities. So what exactly is bone marrow? There are two types of bone marrow. We have red marrow and yellow bone marrow. Here we have a picture of some red marrow, although it does look like a little bit of yellow marrow in there. So red marrow tends to fill all of our epiphysis, so the ends of our long bones, as well as any of the spongy areas within our flat and short bones and so on. So red marrow, the purpose of it is the site for hematopoietic or red blood cell production. So it's hematopoietic tissue. This is where we'll be making all of our red blood cells, platelets, and much of our white blood cells, but not all of our white blood cells. Our yellow bone marrow, which makes up a majority of our medullary cavity, is composed of adipose tissue. Do you remember adipose? This is basically our fat cells. Okay, now fun fact, when you are just a child, you tend to have all red bone marrow, even within the medullary cavity. And the purpose is our bodies are so busy producing red blood cells and white blood cells during that early growth. But as you become an adult and your needs for producing white blood cells and so on is pretty much established, and so therefore we will be essentially storing all of the excess fat that we take into our bodies in the form of yellow marrow. But what's really interesting, anytime there's any kind of traumatic event such as an injury, our yellow marrow will pretty quickly convert into red marrow in order to help replace all of the blood loss during some sort of trauma. Now to look at the microscopic anatomy of bone, particularly that of compact bone, we have, as we can see here, we have these rings that will form the outside of our bone. They'll just go completely around, forming the outermost component of our bone. And then On the inner parts, looking at the diaphysis here, we have these smaller rings here. These rings are known as an osteon, so each component of a ring is known as an osteon, which is the structural unit of our bone, our compact bone, or skeletal system. And then we have in the center of the osteon, we have a hollowed out canal or space known as the Haversian canal. It's going to allow for blood vessels as well as nervous tissue to pass and provide nutrients and innervation to our bone. In order to have our blood vessels pass from the exterior into the medullary cavity to provide the nutrients throughout, we're also going to have these horizontal canals here. These are known as Volkmann's canal. I'll spell that out. So Volkmann's canals, and that's going to allow for passage of nutrients horizontally. And again, we have our periosteum, which is the outermost layer, which will anchor our blood vessels. The spongy bone, rather than having these concentric rings, we have what's called trabeculae. So that would form all these little spindly shaped bone of our spongy bone. In this image here, I just want to really zoom in and get a much better look at some of the components of our osteon here. Okay, or a Haversian system. So again, this would be the Haversian canal, which is in the center of one osteon system. And looking much, much closer, all of these little black dots here, okay, these are the cells, the everyday cells of our osteon or our bone tissue, and they're basically going to maintain the metabolism and everyday needs of the bone. Those cells are known as osteocytes. So cyte we learned as being cell, and so an osteocyte is a mature blood cell. Okay, and then the osteocyte, there's actually a space that allows the osteocyte, gives the osteocyte a little bit of wiggle room here, and the space is called a lacuna. We learned about lacuna back in the spaces that surround the chondrocytes within cartilage, so lacuna. So osteocytes exist within a lacuna. And then we have all of these little canals here. They're called canaliculi, and if we look closely enough, we can actually see almost like it looks sort of blurry, but this veining right next to, so all within here, this veining within there, those are the caniculi, and that's just going to allow nutrients to pass in between each of the concentric lamellae here. Okay, so those osteocytes will reside within the compact bone, within all of those lamellae, but we also have several other types of bone cells that exist as well. On the outermost layer, we will have what's called osteoblasts. So osteoblasts are responsible for building new bone, and they will exist on the outermost layer. So as we need to build more bone on the outermost layer, we will make use of these osteoblasts. So they're going to place all of that bony, hard calcium matrix on the outer layers. Also on the outermost layer, we have what's called osteogenic cells. And osteogenic cells, they are the stem cells. So they're going to give rise to all of the other cells as they die and are injured. And then another very important type of cell here is called an osteoclast. And osteoclasts tend to be on the innermost part, and they're going to be involved in resorbing bone. So anytime we need to reshape, regrow, do anything, maybe we have some fracturing, these osteoclasts are going to come along and then just sort of clean up and help to reshape the bone as needed, a lot like a sculptor would with a piece of clay. And that is it for our lesson on bone structure.